Every year in the United States alone, there are between 100,000 and 200,000 ACL tears. While this number may seem small at first, when you start to think about it deeper, it begins to seem like a much bigger deal. If 100,000 to 200,000 people have such a specific ligament injury such as a torn ACL that is very rare to occur already, the number seems much greater than it is. The torn ACL occurs in such specific circumstances that includes cutting or rotating to where it is already very unlikely for it to occur at all. The large number of people who have had a torn ACL happen to them shows how unnecessary and adequate breakdown of the best ACL graft type really is. It is such a big problem in the sports world as well. Every year, multiple athletes also get the devastating news that they tore their ACL and that their season is over. That is a tough pill to swallow for anyone, including athletes who make their livelihood playing professional sports or play it for their personal enjoyment in interscholastic or recreational sport. However, the news of the torn ACL is the beginning of a long and grueling surgery, rehab, and recovery process that will most likely span over the next year of their life. As someone who has experienced this firsthand recently in my life, the process is one where a person has a lot of questions and uncertainty about the best course of action could be. I was very lucky to have a great support group around me that included a highly regarded surgeon, a very well-respected physical therapist, my team's athletic trainer, and the support of my parents. However, that did not save me from the problem of choosing a graft type that is not the most optimal. The graft type I chose led me to have a revision surgery 6 months after the original procedure, and it also gave me numerous hindrances throughout the process. This created the passion for me to dive deeper into the topic of the best ACL graft type and gather multiple sources of research to identify the best graft while also providing adequate evidence to back up and support the claim. This whole process I underwent brings me to this presentation today about the best ACL graft type for the best short-term and long-term results. The debate on ACL graft choice and type has had a very long and controversial history. There have been numerous claims about the true best type, but not one claim has been made to where it has been agreeable to all the differing sides. The best graft choice is not a clear-cut matter of fact, rather that it is an opinion that can be justifiable with the correct evidence and context that is needed for each individual patient or situation. However, there can be an overall best graft type that has a wide range of success in all different aspects of patients. From young to old, from sedentary lifestyles to active lifestyles, that opinion can be one that is very broad and fit for all people but may not be the best for each person. That is the main struggle that comes along with this topic. Numerous athletes and individuals experience the same process and never have a clear-cut answer. The problem with this is that the information they are given may not be the most accurate and can severely hurt them if conflicts and problems arise from the graft they are guided to choose. These patients are never given a clear-cut answer because of how different the situation and circumstances are for each person. This can greatly jeopardize the health of them short-term and long-term when the wrong decisions are made or misinformation is given. Overall, the graft type choice is such a controversial topic, but as research is collected and data is analyzed, the more confident and accurate the opinion may be. The quad tendon graft is the best graft option because of the low re-rupture or failure rate, the fact that it is an autograft, and the overall short-term and long-term functionality of the graft. The low re-rupture or failure rate is a great incentive and reason to choose the quad tendon graft. In a research study conducted by Kavinak, it is stated that when compared to the hamstring tendon graft, the quad tendon has a lower morbidity level. The morbidity level in medical terms refers to the medical problems caused by the treatment. In this case, that would be linked to re-rupture rate or failure rate and can cause revision surgery or another reconstruction surgery. This research point supports the claim greatly, especially since it was backed and proved by the research taken in the study. Another study by Winley Dye states the claim that the quad graft had a better graft survival when compared to the hamstring tendon. In addition, it also states the donor site morbidity rate was significantly lower in the quad tendon grafts when compared to the hamstring tendon graft and bone-to-bone patellar tendon graft. These two claims reflect the views of the original reasoning for the quad tendon graft. The donor site morbidity being lower for the quad tendon grafts help lower the risk and rate of re-rupture or revision surgery by keeping the overall health in the patient's surgical leg. That would directly affect the graft if the muscles in the leg had atrophy and got weaker from a strength standpoint. The graft having a better survival means that the graft will not decay or break down once inside of the knee. That is a very great sign to have in a knee, because of how the risk for a revision surgery would decrease if the graft was shown to have good health. Good health in the graft also leads to good functionality and help the patient move along in recovery. Another research study was conducted that also has the results that compared to the claim at hand. The research conducted by Wright states that the re-rupture rate in the soft tissue autografts, such as the quad tendon graft, are significantly lower than those of the bone-to-bone patellar tendon grafts. Soft tissue grafts are shown to have a lower rate of re-rupture and would then lead to a lower rate of revision or reconstruction surgery. The soft tissue graft category contains hamstring tendon and quad tendon. Therefore, it has shown proven once again by research that the quad tendon has a lower re-rupture rate than other grafts. In a research study by Runer, it also shows that the odds of revision surgery were 2.7 times greater in patients who chose a hamstring tendon autograft compared to a patient who chose a quad tendon autograft. This further supports the claim that the quad tendon graft has a lower risk of a revision surgery. The long-term and short-term benefits of the quad tendon graft are much greater than any other graft type. Lund reports in an article that the quad tendon graft resulted in less kneeling pain, graft site pain, and sensitivity loss than that is seen in the patellar tendon grafts. The short-term and long-term benefits of having less kneeling pain, graft site pain, and sensitivity loss further boost the incentive of receiving the quad tendon graft. These reasons are short-term and long-term benefits and gives more reasoning for the quad tendon graft. In addition, the quad tendon graft is shown to have equal or better functional outcome when compared to the hamstring tendon and does so without affecting the morbidity of the leg muscles. The long-term effect of better functionality is a huge factor for choosing the quad tendon. On top of that, the added benefit of the graft site not being affected by morbidity gives an even greater reward and incentive for the quad graft. To add on, the data from a study by Wenli Dai states that the quad tendon graft revealed better functional and stability outcomes than compared to the hamstring tendon. The overarching theme that is present throughout all these articles and studies is that the quad tendon graft contains the necessary short-term and long-term benefits for it to be the most viable and best graft choice for reconstruction surgery. Overall, the graft selection process is a very tedious one where no definitive right answer could be present. The context of the situation and other factors influence the graft choice and the outcome of each surgery. However, the quad tendon graft is the best graft option because of the low re-rupture failure rate, the fact that it is an autograft, and the overall short-term and long-term functionality of the graft. This claim and reasoning are backed up by both scholarly data and brings popular sources in to further go in depth on these claims and bring adequate research and data in, as well as accuracy and credibility to the topic at hand. Patients beginning this recovery process, or who are in it, or almost being done like myself, need to read this information. This information can help you reflect on the graft that you chose and see if that was the best option if you are past surgery. However, if you are patient and are still waiting to get surgery, this information and claim is vital since it has most relevancy to you. The graft choice you make can have lasting impacts on your health in the short term and long term. If the patient does not choose the optimal graft type, the graft will choose the outcome of the patient. The overall health of yourself is of the most importance, and the quad tendon graft helps you preserve that and also brings many incentives in that will further help you in your recovery.